calls to the National Suicide Prevention Hotline have risen 300%. While we're so fixated on what this virus is doing to the physical health of us and the health of the economy, what about our mental health? We check on that next with a local mental health expert. This is Kansas City Week in Review. And joining us now is Kansas City psychologist and author, Dr. Linda Moore. Dr. Moore, when dentists are now no longer seeing patients and we see many regular health checkups being postponed, are you still seeing patients?
On the phone.
On the phone. Does that compromise the therapy that is being provided?
I think it changes it dramatically because I miss the body language. I miss the shifts in facial expressions, all of which give me a lot of information about what people are saying.
We see reports and we see that, there's a 300% increase in the suicide hotline. Are you seeing an increase in the number of calls coming to you, or is it still about the same?
It's about the same, and part of it is most interesting. What I've discovered is my clients don't have the privacy at home to talk on the phone that they would like to have, because they have all their children there, their spouses, everybody's working, and it's sort of chaotic. So some people are taking their time.
Have the concerns changed, or are they the same as they were before?
I think amplified. In other words, things that we already had difficulty dealing with were now like in the system, and if we went away to work and school and avoided talking about them, now we're together all the time, and so they get amplified.
We're also hearing about not just on suicide, but we could see a massive increase in the number of divorces. We can see a lot more domestic abuse cases taking place. Are those scenarios and headlines overblown?
I haven't seen it yet, so that could be coming, but I'm not seeing it right now. I'm just seeing people struggling with talking to one another when, in fact, they have not been talking to one another anyway, and now they're all together. And so people are a little scared, a little uncertain about how to handle things. And one of the biggest issues in our culture, 75% of us are extroverts, 25% of us are introverts. And so when those people live together, it makes it very complicated. And the reason that's important, extroverts rebuild energy by interacting, by being out and about in cultural events. Introverts replenish energy by being quiet, peaceful. So if you have people living together who have those different needs, it can be really hard.
So what is the big advice that you're offering over the phone right now to calm down your patients and, in fact, the people watching this program right now, Dr. Moore?
Well, one of the things I suggest is please establish a routine. Please get a routine together for everybody in the family that works. Create quiet time, alone time, and have family meetings. Even the littlest kids will contribute to a family meeting where you discuss, how are we doing? And what's not working and what is working? Because our thoughts make us get more and more stressed. For example, if I say, this is difficult, this is hard, this is challenging, I'm okay. But if I add to that, and I can't stand it, then I'm doing something called thought distortion, and I can react to the distorted thought rather than the reality. So we come back to, I don't have to like it, but it's here and I have to deal with it.
What's the one thing I can do right this moment as I'm watching this program to reduce my anxiety level at this moment in time, Dr. Moore?
Well, one is constantly breathe, constantly take deep breaths. Learn to meditate if you can. There are all kinds of apps for doing that. Learn to meditate and move. Get some movement, particularly if you have small children. Get everybody moving.
Psychologist and author Dr. Linda Moore, thank you so much for being with us, keeping us on an even keel during this half hour on Week in Review.